So chapter 26 is the urinary system, and the anatomy of the urinary system is pretty straightforward. You have a couple of kidneys, and you have some ureters, and you have a urinary bladder, and then you have a urethra that extends from the bladder to the outside. So the kidneys are really tasked with filtering your blood. And so let's kind of get a big picture of everything that's going on here. You eat food, drink liquids that contain nutrients and substances, and that goes into your digestive tract. And your digestive tract then is tasked with deciding what gets absorbed into the blood, right? And so certain things are going to get absorbed into the blood. And what does not get absorbed that stays in gastrointestinal tract then gets defecated out, or we like to say poop out. It's a very sophisticated word. Defecation is the correct scientific term. But these nutrients are getting absorbed into the blood, and the blood, as you remember, is getting absorbed into the mesenteric veins, and those mesenteric veins merge into the hepatic portal vein, and the hepatic portal vein then goes through the liver, and so the liver is filtering, adjusting nutrient concentration, taking what it needs out of the circulating blood, and then sending it on via the inferior vena cava right into just the cardiovascular circulatory system. And now it's delivering it to all the rest of the cells of the body. They're going to get the nutrients and so forth, and the cells are going to get rid of their waste, and the waste then goes back into the blood, and this blood circulates. And so one of those wastes is carbon dioxide. It's a byproduct of cellular respiration from the cells, transferring energy from nutrients to ATP molecules. That is going to, I'll fix that right there. The carbon dioxide is going to get blown out in the respiratory system, right? So the respiratory system takes care of the carbon dioxide. And then whatever other waste products and filtering of the blood that needs to be done gets done in the kidneys, right? So this is urinary system. And so this is really where your urine filtrate is created. And so we kind of have this list of functions that the urinary system does. And, you know, it regulates concentrations of ions, sodium, potassium, calcium, so forth. It regulates blood volume and blood pressure. And we talk about this really a lot more in physio. And adjusts the volume of water loss. Remember, their hormones, antidiuretic hormone targets the kidneys. Erythropoietin is produced by the kidneys. Renin is produced by the kidneys. Calcitriol is produced. So there are hormones that are produced by the kidneys that we've gone through. Renin is the one, it's more like an enzyme slash hormone. And we get into this in physiology because really renin eventuates in aldosterone being released. Anyways, aldosterone. We talked about this. It's an adrenal cortex, so it really doesn't go too far because the adrenal glands are on top of the kidneys. They're suprarenal, and renin is an enzyme that converts angiotensin 1 to angiotensin 2, which stimulates aldosterone to be released, and aldosterone then targets the kidneys and the nephrons, to be specific. So we go through this cycle again in physio. And so there is this adrenal function or suprarenal function along with the kidneys, as well as stabilization of pH. Look, the kidneys can do bicarb or hydrogen. So it's an acid base that it can excrete more or less. So it controls pH that way, conserves nutrients by keeping them or eliminating things that you don't need. Oh, I have calcitriol down here. And also just kind of detoxifies, gets rid of medications that might not serve any purpose, and gets rid of those. Anything that is foreign medication type substance is going to get excreted in your urine. You have no way of reabsorbing these synthetic substances. So that's why we check urine for a lot of reasons, but one of them is, you know, certain drugs or medications are going to show up in the urine. They get filtered out and they never get reabsorbed back into the body. So you urinate them out. As far as the anatomy of the kidney, the urinary system, again, there's a right and left kidney. They each have their own ureter, and ureter transports the urine filtrate that is made by the nephrons of the kidney, and they transport it down to the urinary bladder. And then there's a urethra that extends to release the urine filtrate once the bladder has enough volume. The kidneys are retroperitoneal, meaning they're behind the peritoneal membrane. And again, the adrenal, or they're also called suprarenal glands, are on top. And remember, those are endocrine, except for the adrenal medulla that is kind of part neural because it's controlled by the hypothalamus. So urine is the fluid waste product that was formed by the nephrons of the kidney. And it will contain water, ions, small soluble compounds, things that are not organic to your body, medications, whatever. It will get rid of it. Urination is actually the muscular contraction of the bladder and the release of the urine through the urethra and out the external sphincter of the urethra. The position of the kidneys, they are actually retroperitoneal, so they're behind the peritoneal membrane, and there's a lot of fat packed in around the kidney to protect it. And then you have the fat there. We then have this fibrous capsule here that kind of really stabilizes where the kidney is located. And I actually did a bad job here because this is the fibrous capsule. And then we have the renal fascia as well, that's even more on the outside. So the renal fascia is kind of here and around. On the kidney itself, you have what's called a renal capsule. So adhering here to the inside and around the outside of the kidney, there is a capsule. So this is to say, is very well protected and is very well suspended in these layers of connective tissue. And it's so you cannot move that kidney around even when you fall or get hit. The kidneys are back by the ribs. So these are the ribs. And so it's pretty close to your back muscles. So a lot of times if kidneys are infected, people will have back pain as a symptom. They're just pressed right up against where your erector spinae and your quadratus lumborum are located. And psoas major is in there as well, right? So we want to remember some of our muscular anatomy here. Remember, quadratus lumborum is back here attached to the iliac crust. You have the iliacus, and you have the psoas major that comes down, goes through is behind the peritoneum, and will become the iliopsoas attached about here. So just kind of going through these fun muscles. Left kidney is a little higher than the right kidney. There's an indentation called a hilus or a hilum, depending on the book version. They actually changed it from like version 6 to version 7. Either way, it's just describing that indentation where the renal artery and vein and ureter come out. So it's this indentation there. Now, if you do a frontal section on the kidney, you see the way it's kind of set up. So let's see, the kidneys here have the cortex. So this is the renal cortex. And then the medulla is on the inside. So just kind of like the adrenal gland, you have the cortex on the outside, and then you have the medulla on the inside. And the medulla has these pyramids that are formed here, and these are called renal pyramids. So you're going to see renal pyramid, here. And these renal pyramids, when you count half of these columns here, that becomes a renal lobe. So when you see renal lobe, what they're talking about is a renal pyramid, the renal cortex associated with it, and half the renal lobes on the sides, or renal columns. Sorry, columns. And then again, remember the outer layer has that renal capsule. So in the cortex, this is mostly where you're going to find the nephrons. So 85% of the nephrons are called cortical nephrons. And they're up here. And they'll have tubules that will drain. And these tubules will drain here into what is called the minor calyx. So these are minor calyces. All of these. So these tubes right here, these are all minor calyces. And then the minor calyces will join into a bigger tube, and that's going to be referred to as a major calyx. So the major calyx are going to be here and here. They're the bigger tubes. And then all of the major calyces are going to merge here in what is called the renal pelvis. And then the renal pelvis just narrows to actually become the ureter. And so the urine filtrate is coming here through all these little collecting tubules into the minor calyces, and those minor calyces will merge to major calyces, and they'll merge to the renal pelvis, and then that will kind of form the ureter. These minor and major calyces are three-dimensional, really, even though this side here looks very two-dimensional. In reality, these minor calyces are going in 3 different directions throughout the kidney. So urine production is occurring here in the renal lobes and ducts, and it will drain to the renal papilla. The papilla are these little holes that are existing here at the kind of apex of the renal pyramids. So these would be the renal papilla. And then they would basically release the urine filtrate into the minor calyx and major calyx, so forth. This is giving you kind of a little bit better view of the nephrons. And since the kidneys filter blood, it is really important you understand really the direction of blood flow. So in physiology, we really talk about how these nephrons are filtering and creating urine filtrate. And so you get into that in physiology, but in anatomy, you need to know the anatomy, and that includes the anatomy of the blood flow. And so you do have a renal artery that goes in. So you start with the renal artery, and that renal artery is going to split into segments, going to different areas, upper area of the kidney and the lower. And so those are segmental arteries. And then these segmental arteries here are going to branch, and they branch into interlobular arteries. So the interlobular arteries are going to be these branches that come around off that segmental. And then these arteries arch around the bases of the renal pyramids, and those are called arcuate arteries. So arcuate arteries arc, you can see here, they arc around the base of the pyramid, and off these arcuate arteries, you're going to have additional interlobular arteries. They're the ones that come up here into the cortex. And off these interlobular arteries, you're going to have afferent arterioles. And these afferent arterioles are these, I'll do it here, are these little branches. And these afferent arterioles become the glomeruli. So the glomerulus is this capillary knot where things get, capillary knot, where urine filtrate really begins. So this is where, glomerulus is where blood from the afferent arteriole gets filtered, gets initially filtered. And so the glomerulus is where filtration begins. And then that capillary knot, the glomerulus, turns into the efferent arteriole. So it's coming out of the nephron. This capillary is coming out of the nephron, and it forms another capillary knot. So a second capillary knot called the paratubular capillaries. And these capillaries will surround the nephron tubules, and as the urine filtrate gets fine-tuned, about 99% of the original urine filtrate will be reabsorbed into the paratubular capillaries. And then they will merge, become venules, and eventually the renal vein. So that's why this blood supply to the kidney is super important to kind of understand. On here, it's showing you there will be the afferent arteriole coming in and becoming the glomerulus, which is this. And then you're going to have the efferent arteriole, which becomes paratubular capillaries. And they're not showing you the paratubular capillaries, but they really are surrounding, well, that's a bad color to choose. They're kind of surrounding the nephrons. Cortical nephrons are the ones that are located in the cortex, which this is the cortex. And the juxtamedullary nephrons begin in the cortex, but drop all the way down into the medulla. And these only account for roughly 10 to 15% of nephrons. They're for specifically concentrating urine. The other thing is, here's a minor calyx and where it begins, but there are little holes here, and those are the renal papilla, these holes. So this is kind of showing you the glomerulus, right? So you have the glomerulus, and that's that capillary knot, and this is going to be the afferent arteriole, and this would be the efferent arteriole, and then the efferent arteriole becomes the paratubular capillaries. So the glomerulus is surrounded by this kind of fibrous capsule, and that's called Bowman's capsule or the renal capsule. And that renal capsule will then narrow and become what is called the proximal convoluted tubules. And so again, you have to remember, here's where the urine filtrate is born, and that urine filtrate is going to travel right through the proximal convoluted tubule, and the paratubular capillaries, oops, I didn't mean to do that, are surrounding the proximal convoluted tubule. And so things getting reabsorbed out of the urine filtrate are going back into those paratubular capillaries. That will become, then the loop of Henle will come down, and then you have the distal convoluted tubule. So looking at the nephron, it kind of stretches it out in a weird way here, but you again have what is called the renal corpuscle, which is the glomerulus, and Bowman's capsule, or the glomerular capsule. And then it will narrow and become the proximal convoluted tubule. And then the proximal convoluted tubule will come down, the descending loop of the loop of Henle, and the ascending loop of the loop of Henle. And so the book calls it the nephron loop, but it's always been called the loop of Henle, because Henle discovered it. And then after the ascending loop, you have this part, which is the distal convoluted tubule. And then all the different distal convoluted tubules are going to merge into what is one collecting duct. So these are all distant convoluted tubules of different nephrons, right? And there's a lot of nephrons, because if you recall, each one of those balls is a nephron. So you have lots of different nephrons on all of these. So you have all these individual tiny little filtrate systems. Yeah, here it kind of shows it. So you have a lot of little distal convoluted tubules merging into a collecting duct, and the collecting duct opens up. This is the renal papilla, the hole in which the urine filtrate then drains into the minor calyx. And so each area of these tubules has a slightly different epithelium. And so you're going to see cuboidal, you're going to see some cuboidal with microvilli, and so it looks a little bit different because different things are happening in different areas of the nephron. As the distal convoluted tubule, so this is the distal convoluted tubule, passes by the afferent and efferent arteriole, you have these mesangial cells, the juxtamedullary cells, and the macula densa. And these cells are monitoring sodium chloride concentrations in the urine filtrate. This is where renin is being produced and released. And there's also, if it's sensing that the sodium chloride concentration is too low, it will cause vasoconstriction of the afferent arteriole and slow down the urine filtrate. So there's a lot going on in this area. These are what the beautiful glomerulus look like. And so when you get into physiology, you learn what's going on in the proximal convoluted tubule, which is primarily reabsorption of stuff back into blood. Loop of Henle, you have a lot of water reabsorption and sodium chloride reabsorption. And then the loop of Henle, I already said that. And then the distal convoluted tubule, you have kind of a fine tuning of the urine. So there's secretion of stuff back into the urine filtrate and reabsorption of other things like water, sodium, so forth. And that's really hormonally controlled. So here's kind of where the hormones come into play at the distal convoluted tubule and collecting duct. So this is kind of a nice picture showing you the renal papilla where these collecting ducts open up, collecting urine filtrate from all the nephrons. And this kind of gives you the overview of the flow, right? So I would at least know the basics here of the nephron. You start off with the renal corpuscle, which is the glomerulus, and the renal capsule, and then it becomes the proximal convoluted tubule, loop of Henle, distal convoluted tubule, drains into the renal, into a collecting duct, then renal papilla, then minor calyx, then major calyx, renal pelvis, ureter, bladder, urethra, and we're done. That's pretty much it. The urinary bladder, it's a muscular vessel that is just collecting urine from the ureters. And you have the trizone, which is like the smooth kind of funnel. And in the walls of the bladder, you have the detrusor muscle, which is smooth muscle. And as this bladder gets stretched, there are receptors embedded that are baroreceptors. They respond to stretch and let you know it's time to go to the bathroom, at which point, when you decide to relax your external urethral sphincter, which by the way is somatic muscle or skeletal muscle, so you get to control this. And when I say control, listen, this is always contracted until you want to release the urine, and then you have to relax or stop contracting. So that is the external urethral sphincter. Now, this is a male bladder. I know that because the urethra of a male goes through the prostate gland. and women don't have prostate glands. So we'll talk about that in our last chapter. But ureters, they're little muscular tubes as well, and they send urine filter to the bladder. And once the bladder is full, because remember, you're getting urine filtrate. If you're at rest, 25% of your blood flow or cardiac output is going through the kidneys every minute. And so your kidneys are constantly filtering your blood at rest. And so you're creating urine filtrate, and the bladder collects it. Now, here's the beginning of the talk, and that females and males, yes, are different. In females, the urethra is completely separate from the vaginal canal, which is reproductive. So the vaginal canal is here, and that's reproductive. And then the rectum is even behind that. So there's really kind of three openings down there for females. This is the uterus. It's the ovary. And then you have that uterus sitting on top of the bladder here. And so then you have the urethra, the external urethral sphincter that you get to control, yay, so you don't urinate all over everything. And the vaginal canal is posterior to that urethra. Now in the males, a little bit different, right? You have the bladder here, and the urethra actually goes through the prostate gland, as well as the ductus or vas deferens. So here is the testes, and you have the vas deferens, which where vasectomy gets its name, comes all the way from outside on top of the urinary bladder, and it merges with the seminal vesicle to become the ejaculatory duct here. And that ejaculatory duct here is going to merge with the prostatic urethra. And then it just becomes one urethra, the spongy urethra, out. One opening, as well as the rectum. So two systems in one in the males, and that's why urologists tend to deal with male urinary and reproductive. Nephrologists deal specifically with kidneys and the nephrons of the kidneys. So you have a nephrologist and you have a urologist. So there's two different specialists really dealing with the urinary system. And then they also kind of work with the reproductive system because they're tied in together. Urinary reflexes, you have an urge based on the baroreceptors in the transitional epithelium of the bladder activating. And that will basically stimulate parasympathetic activity and decrease sympathetic activity. So you stop contracting muscle, right? Two ways. And then you basically can void out your urine. Age-related problems, oh God, number of functional nephrons decrease. So nephrons decline by 30 to 40% between the ages of 25 and 85. Now, that's a 60-year span, so it's not a short span. But that's a lot of decrease in blood filtration ability, and as well as the glomerular filtration rate declines. So in the glomerulus and the nephron, there's a reduced sensitivity to antidiuretic hormone, and so older people tend to urinate out more liquid. Micturition problems, we would call it incontinence, not being able to hold your urine. Prostate problems can cause that. Number of vaginal deliveries can increase a woman's rate of becoming incontinent. So really fun stuff. And then our last lecture will carry on from there because we're going to be talking about the reproductive system.